Thanks for that introduction, and it's so wonderful to see you all here. It's a gorgeous spring day out there. We finally did it. We've had this conference over the last 3 days now, and the weather was appalling, and just as everyone's getting on their planes to go back to their states, now it's a beautiful day. But anyway, we've got to move on with that. In Australia today, we are getting larger. Yes, do you think? Yes, trouble. There's some trouble out there, but it's okay. You're here. We're going to fix it. We're less fit. Do you think so as well? And we're less active. In the old days, we put clothes on the line, we didn't have remote controls, all of that stuff, we didn't get outside, get in the car, go to work. Things have really changed over the last 50 years, and that's why all of this is happening. So we need to get onto it, and if you're here today, I reckon you're onto it. So let's go with that, shall we? Now, the weight gain is mostly around the waist. Anyone worried about their waist? It's horrible when you sit there and that stuff sort of rides up, isn't it? Many of us are showing signs of developing diabetes, high blood pressure and high cholesterol. And I take it you're all a bit worried about it because you're here today. So that's good, because I'm going to get in there somehow and we're going to change. Even if we change one thing in our lives today for your own health, that would be a fantastic outcome. So let's all try and do that. And that always includes me when I do these presentations. So that's good. I'm getting healthier each time. Many of us are not getting enough calcium every day. So we'll go through that. And many of us are skipping meals, especially breakfast. Did anyone have porridge this morning? Yes? Yes, very good. I did that too. It was a long time ago now. Did anyone go in the marathon today? Wow, that's amazing. Well done. I drove happily past the marathon runners. I thought, that looks good. Well done. And Andy. The average lifespan of Australian women is 84 years. So we're living, touch wood, quite long. Midlife is a great time to review your health. And if you're not actually at midlife, if you're before or if you're after it, it's still a great time to review your health. So I'll be talking to all aspects at all points in life. Now, in terms of heart disease, this is the leading cause of death in postmenopausal women. There's a huge increase in that risk after menopause, and menopause is just the last period whenever it happens, okay? Average age of 51, we'll be going through more of this later, but it's just the last period that you have. Early menopause, there's a much higher risk of heart disease, so we'll touch on that as well. Now, heart disease in women, we all think because of the media and because of the prevalence and because of mammograms and all that sort of stuff, and because breast cancer is scary, we all think we're going to die. They've done surveys of this, and women think they're going to die of breast cancer just because they're hearing about it and they're worried about it. And we all know someone who's had breast cancer or breast cancer treatment. But we're 4 times as likely due to die from heart disease than breast cancer. So this is something that we can do something about. Heart disease is the #1 killer of Australian women. Now, I'm not trying to be morbid here, all right? So don't feel depressed and don't leave the building, because we're going to turn this around. Just say the bad stuff, get a bit worried, and then let's change it. Heart disease claims 29 female lives every day. So over 10,000 deaths in 2009. That will be increased now. 90% of women have at least one risk factor for heart disease. And look at this, half of us have 2 or 3. So, and the things we can do to reduce these risks. Screening is less common in women because we think, oh, that's a male thing, it's a thing you get when your blood pressure's up, it's a thing when you smoke, and I don't do any of that, so forget it. Counselling, education and risk management are not as frequent because we don't perceive women to be at risk, or doctors as a group haven't. Treatment tends to be less intensive and aggressive, and presentation for heart disease in women can be later and the diagnosis slower. And the outcome, and they've done recent research on this, the outcome can be poorer. So that's a bit scary, isn't it? I've been the mean Sonia doing all of that. I'll try and get the nice one up in a minute. Our biggest risk factor for heart disease is atherosclerosis. So I'm going to do something with my hand, and that's make a heart. That's about the size and shape of a heart if you look at my hand. The coronary arteries go between the gaps between the fingers. They are small. They are responsible for delivering all of the blood to the heart that is responsible for making the rest of you move and work. So you can imagine if those tiny arteries start to get clogged up and stop this organ, which is essentially very small and it's running the rest of your body, things can become unstuck very quickly. So this process is called atherosclerosis. You get narrowing of those tiny little vessels, a reduction in the blood flow, and when you get a blood clot or a cessation or stopping of the flow within that artery, that's when you can get to a heart attack or a stroke. So people don't really understand, they don't really understand what a heart attack is, but essentially we're relying on these tiny vessels and for that clot to not happen, and we want those vessels to be beautiful and clean and not get clogged up with a whole lot of cholesterol and junk. So you can do that. We're going to talk about that. Are you at risk? Have a look at this. Do you have a family history of early heart disease? So anyone, first degree relatives, mum, dad, siblings, angina, bypass surgery, heart attack. Elevated blood cholesterol, and this is more and more prevalent. Almost all of the menopausal women that I do a cholesterol level in, so that's around 50 and over, they will have a raised cholesterol compared to their younger selves. So there's something going on with hormones at menopause that's sort of modulating that risk in terms of raising cholesterol. Not in everyone, but in a lot of women. Blood pressure is an issue as well. So we want that blood pressure to be about 120 or 130 on 80, if that means anything to you. Your doctors can easily check that. Your pharmacy can often check that as well. And I've been, I shouldn't say names, but I've been to a commercial electronics outlet in town. You can get a blood pressure monitor for $65. And I thought that was a pretty good investment for those who are at risk or who have issues with blood pressure and want to check it at home. Smoking, now that's a really big issue. Smoking independently can clog up those arteries, and that's how people who smoke get heart disease. Diabetes as well. Excess body weight, especially when it's tummy weight. So they've done studies looking at the distribution of fat on our bodies, and this tummy weight increase has been shown to put you at risk of heart disease. Lack of exercise, and I find this one amazing as well. Stress and being socially isolated, so not having supports, being on your own, doing it a bit tough, that can increase your risk of heart disease. So there's a message in there, isn't there? So this is the good bit. So you're all conditioned, you're all listening, that's excellent. We're now going to try and lower our risks. Well, it's sort of easy to say, a bit harder to do, but I know you're in there, you're enthusiastic, you're here, so we're going to do it. Healthy lifestyle is very, very important. So healthy eating, no smoking, increasing your physical activity, relaxing and enjoying yourself and saying, yes, I'm a good person, I'm going to be happy and do that good stuff. And have ongoing heart disease risk assessments with your doctor or with your medical practitioner. So this can be pretty easily done. And often, if they're very busy, you might need to say, well, what's my heart disease risk? Can we look at this? So in terms of weight, there's a bit of an easy way to look at it. So if your food going in equals the amount of activity and the sort of calories you're using up by running around the place, you're okay. You're maintaining your weight. But if there's too much food and you reduce your activity or there's too little activity, you're going to gain weight. There is absolutely no rocket science in all of this. So that's the bottom line with how it works with regard to weight. So when we're looking at weight gain prevention, there's a whole lot of issues with all of this. When we're looking at diet, to start with, you can see the benefits with diet. You can prevent that gain in weight, you can enhance your long-term health, reduce your risk of cardiovascular disease, you can reduce your blood pressure, your cholesterol as well, you reduce your risk of diabetes. Some cancers are related to our weight, like womb or endometrial lining cancer. Depression, mood and well-being can improve with a healthy diet. And you can also improve your bones. So this is what you're all here to hear. I'm going to talk more about it. It all seems very easy when it's on a slide like that. It's actually going home and thinking, what do I do? So we're going to do it. Yes? Yes. So these are essentially the messages. And I know various people will have different metabolisms and different diets and different backgrounds. You've got to sort this out for how it suits you and how you can live with it. But a healthy diet, plenty of vegetables, legumes and fruits, plenty of cereals, including breads, rice, pasta and noodles, and whole grain is usually better. Lean meat and fish, poultry and or alternatives if you have a vegetarian diet. Milks, yogurts, cheese and alternatives. Reduced fat varieties if you can, and drink plenty of water. The dentist told me, I have a 7 and an 8-year-old, the dentist told me when they were essentially born they should drink water and they should drink milk. And I said, what about juice? No juice. So essentially for their teeth, they're doing milk and water. Let's include more water. They are having some juice, but we're brushing, don't worry. Alcohol. Now I'm amazed by women. Some women drink nothing. Most women drink a bit. And some women have a lot. So have a look at this, because I'm quite surprised, and it's not a criticism, it's just how people live, I suppose. This is looking at your standard drink. So the standard drinks differ in terms of what sort of drink you're having, whether you're having wine or whether you're having a beer. So that's 1.5 standard drinks there, 375 mils of full strength beer. Just looking at you, I reckon we're on this side of it. Am I right or am I wrong? Would we more go for the wine? That's again not a criticism. You can have whatever you like. But this is 1.8 standard drinks in that glass, all right? To reduce the lifetime risk of harm from alcohol-related disease, we do say, and this is our NH&MRC, this is our regulatory health body for Australia, they say 2 standard drinks maximum in any one day, and 5 days a week. All right, so you're looking at about 10 standard drinks a week for safety. And you should have 2 alcohol-free days if you can. That's just what the guidelines say. So I know a lot of you will probably not be having even that. We do need to take care. Now this is sort of the bad group. We shouldn't say bad, but we do need to limit our saturated fat and our total fat intake as well. Choose foods low in salt where possible. Limit your alcohol. You know how to do that now, and you're already probably doing it. Consume only moderate amount of sugars and foods containing added sugars. And there's a lot of sugar out there. And do you remember the fuss that was caused in New York where they're trying to reduce the size of those maxi colas? So there's a lot of resistance out there, but essentially these things are going to make a difference. And be aware of portion sizes as well, because you can sort of get a bit used to having a bigger portion size and start putting on weight because of that. Now, the human body, our skeleton, our bones, muscles, we're designed to move, okay? That is absolutely, whoever designed it, I don't know if it's creation or whatever, it's designed to move. So we should be moving. We should be making physical activity an everyday habit. How many out of you think you're doing enough exercise? Yeah? Well, that's fantastic. How many would like to do more exercise or think you should do more exercise? Good. So after today, do you know what you're going to be doing? More exercise. Now that's because it's spring, with daylight savings, you're on a winner. So but when you do exercise, you work out pretty quickly that you, 1, love it, and if you don't love it, choose something you love, and 2, you get an enormous benefit out of it, whether it's well-being, having a trim figure or whatever. So try and make it an everyday habit, or 4 or 5 times a week or 3 times a week habit. So what are the benefits from physical activity? We just looked at diet before, and you'll see they're pretty similar, aren't they? A prevention of weight gain, long-term health, heart disease, blood pressure, etc. Also colon cancer, so we're reducing the risk of cancers without physical activity. Depression states, those who exercise have less depression. They feel better. There's those natural endorphins that are released when you exercise. And also bones. Bones are very important to have and to keep nice sort of strong bones. Physical activity definitely can help your bones. So what are the guidelines with regard to what we should be doing with physical activity? I love this statement. I don't know where it comes from, but it's a great statement. Think of movement as an opportunity, not an inconvenience. So if you see the stairs, take the stairs. If you can park further away in the shopping centre, do that. Just to get a little bit more exercise. If you can carry a few extra bags a bit, I love this. Make it an opportunity. Be active every day in as many ways as possible and put together 30 minutes of moderate intensity exercise most days of the week, all right? And I know that doesn't suit well with our lives. We're busy, we're running homes, we're running businesses, we've got all this stuff, we've got dependents and all that stuff. You do what you can, but you've got to do it for you because no one else is going to do it, right? Got it? Got it. So 30 minutes most days of the week, and I usually say about 3 to 4 times a week, quite moderate intensity, such that you're puffing, okay? It's no use if you've got a 15-year-old dog, taking that aforementioned dog out. If the dog stops at every tree and you only go 100 metres, it's not doing anything. The dog needs to be rested, you go off and you do them later. You can do this by combining multiple 10 to 15-minute bouts of activity. So whatever way you can do it, lunchtime, getting the runners on, if you work in the city or whatever, just do it, just go, if you can. You do need to be huffing and puffing, all right? So you do need to be working your body to be getting a benefit from it. And it adds an extra level to achieve greater health and fitness benefits. And something is absolutely better than nothing. So whatever you can do. Remember Dancing with the Stars that was on recently? We all at home, the 7 and the 8-year-old and I all got dressed up. The dancing was on, we all danced. It was hilarious. We had a great time, we really looked forward to it. So you do whatever you can. And that was exercise, I felt good. So before you start there, if you're not used to exercising, you should be warming up, cooling down and stretching. If you don't know what to do, a physio is the best person to help you through it. And usually there's pretty good access to physios out there. Gradually build up if you're not quite active enough yet. So just do bits and pieces. I had a patient who was quite overweight. She started by walking around the clothesline. It was a rotatory one, round one. She walked around. The first day she could manage 5 minutes just walking around. Gradually built that up till she could do 10 minutes, half an hour. It must have been terribly boring, but that's what she did, and she lost a whole lot of weight, and I was really impressed. She did that all by herself. So you can do this. You just have to get into your own psychology and say, I've got to trick myself into getting this and getting a pattern going. And do check with your GP first if you've got issues with your joints or your bones or whatever. Now, strength training is using weights so that resistance is applied to a muscle. And there's a lot of literature about strength training at the moment. It can improve muscle strength, and that reduces the risk of falls. And you sort of think, oh, falls is an old lady type of thing. We can all fall. It just needs to be a bad gutter or a pothole or whatever. When you're walking that aforementioned 15-year-old dog, there's a tree root out or whatever. So muscle strength improved can improve your balance. Increase flexibility and better balance, and there are programs, and sometimes you can access these through your counsel or through your gym or through your physio. So just ask. And on the web these days, you could definitely do a search. So why should we be walking? Walking is a fantastic way of exercising. It's important in the prevention of many chronic illnesses. Osteoporosis, it's fantastic for lower back pain as well. It is pretty easy. All you sort of need is your body and you can go as long as everything's working in all of that, legs and the rest. It improves wellbeing and concentration, muscle strength and energy levels, and it can manage our weight. So I'm just making it sound so easy because you can do it. I know, you're here and you can. Now, what else do healthy bones need? A few things. Healthy eating, we've talked about. Calcium is a really hot topic at the moment with regard to how much calcium do we need, whatever. At the moment, the message is we do need a certain level of calcium to maintain bone strength. Regular physical activity we've talked about. Vitamin D is a very important thing. That's a sun exposure vitamin that I'm sorry you're not getting at the moment, but I know you'll get at the moment you walk out the door. And that we're really at a latitude-wise, we're really at risk of having a low vitamin D level here, because they say anyone south of Coffs Harbour will really struggle to get enough sun exposure to have an adequate vitamin D. So if you've never had a vitamin D, go and talk to your doctor about it. Almost everyone I measure in my women will be low, and mine was low, so that was what really kick-started me. Hormones are also important. Estrogen levels, so if you've had an early menopause, that's menopause before the age of 45 or 40, then you're at risk of having issues with your bones as well. Oh, yes, we've got him. Excellent. What is osteoporosis? So a lot of people come to me and they say, oh, I've got this sore hip and I've got the sore back and I think I've got osteoporosis. And I say, all right, well, let's talk about that a bit further. Osteoporosis is usually silent, okay? Even up to a third of women who've had a spine fracture didn't even know they had it. So isn't that scary? Quite scary. So often it's a silent disease unless you have had an osteoporotic fracture and knew about that. But not everyone does. I know it sounds unreal, but it's true. Bones lose calcium and they get less thick. They're thinner and then they lose strength. So bones, when you look at the structures, does anyone give that dog of theirs the marrow bones? Has anyone actually looked in a bone lately? So it is a sort of spiculated structure with holes in between, and the design of a bone actually gives it that strength. But it's when those holes within bones get bigger, the bones get fragile, you put a trauma on that bone, it fractures, and that's what's happening with osteoporosis. So you can easily break vertebra, or the bones within your spine, hip and forearm, and usually a forearm fracture is when you've fallen and fall out onto that outstretched hand, and then you can easily have a fracture of the forearm, and they're quite common in women as we age. So, I'm glad I've got this. Normal bone, see there's that nice appearance here where we've got our holes within the bone, and you can see that everything's becoming thinner, the holes are getting bigger, and that's osteoporotic bone at a very magnified level, okay? So the World Health Organization has really defined what osteopenia and osteoporosis are. And effectively, it's based on a DEXA scan. Do you know what a DEXA scan is? Yeah, some of you? A DEXA scan is essentially taking a special X-ray of the back, and usually they'll do the hip. Usually it's the left hip by convention. Sometimes they'll also do the forearm here. So they do a modified X-ray. It doesn't take very long, and then they plot you on a curve compared to the population. So they've sort of got statistics for what's low bone density that will fracture and what's normal bone density, and they'll put you somewhere in there. And what they do is they give you this score, which is a T-score, and your doctor can take you through that if you've ever had a DEXA scan. So osteopenia is where you've got mild thinning of the bones, which won't tend to fracture. So it's sort of your warning sign for heading down to osteoporosis. So that T-score is between 1 and negative 1 and negative 2.5, below the normal range for a 20-year-old, because bone density sort of gets up to here, peaks at 20 to 30, and then slowly declines till about menopause, does a bit of a whoosh, and then will stabilise a bit. So there is a curve that goes down with time in men and women, but women get that accelerated bone density loss because of menopause, when their hormones have hit the skids. Osteoporosis is when that T-score is less than negative 2.5. So they're 2.5, what we call standard deviations, between a peak bone mass of a 20 or a 30-year-old. Okay, so that's just the definitions what this means. And here's our graph here. So here is peak bone mass being achieved here. So women are in the dark line, men are in the dotted line. So women, if we follow up to about 20 to 30, gets to a nice peak, and then things slowly fall down till you're 40. Then there's this rapid bone loss over the time of menopause, which is average age 51, and then you sort of stabilise a bit, and this is where you get into risk of fracture. So you'll see with men, they have a risk as well, and osteoporosis in men is coming to be more of a problem as well, now that we're all living longer. So how common is osteoporosis? It's 1 in 2 women, half of us. So essentially, I'm not going to do this well, but it's this half of the room, possibly, if you think of it, over 60 years. So it's a bit scary if you look around. You want to be in the good half, don't you? You are, because you've come to the talk. 1 in 3 men over 60 years, 2 million Australians. That's a lot of us, isn't it? By 2021, 13% of the population will be affected, and it costs the government a lot of money, $7 billion a year, and that's because of the treatments for osteoporosis, the hospitalisations for people with fractures and the rest of it. So you think this is just a bit of thinning with the bones, there's a lot of ramifications, aren't there? 46%, so almost a half of fractures of the spine, and there's 16% hip and wrist fractures as well. So who is at risk of having osteoporosis? A big, strong one is a family history of osteoporosis, especially if mum or dad have had a hip fracture. So you're immediately in an at-risk group. Inadequate calcium intake over your life. Cigarette smoking is an enormous one. I had a patient once who presented with a serious osteoporotic fracture, and she'd lifted a wardrobe. Now, just don't lift wardrobes, or let someone else lift the wardrobe. But her only risk factor was that she'd been a lifelong smoker. She was about 60, and she was appalled that everything became unstuck just because of the smoking. Alcohol doesn't have an influence as well, more than 2 standard drinks a day. Caffeine is difficult because there's so many contents of caffeine. There's your standard cup of coffee, there's your espresso, there's your macchiato and all those things. Essentially, more than 3 cups of tea or full-strength coffee a day, you're probably at less risk. Tea does have reduced amounts of caffeine compared to coffee. But you can do a Google search and find out the caffeine content of your average preparation that you consume. A lack of exercise will put you at risk as well. Early menopause before the age of 45, and having a thin or small body frame. So there's not much you can do about that. So don't feel depressed about that. There's other stuff you can do. Lack of exposure to sunlight as well, because we're all sort of working, we're inside, we're not getting out as much because we don't want to get a melanoma or a skin cancer. We're slapping as well. So there's a relationship there. Having a late first period or a long time without periods, and that might be because you're an elite athlete, or it might be because you were breastfeeding for a long time, it might mean you were pregnant for a long time. There's all sorts of issues here. Long-term use of medications, such as steroids. Here we go. Steroids, so that's typically prednisolone if you've ever had severe asthma and have needed long courses of big dose steroids. Thyroid treatment as well, if it's excessive treatment. And also increasing age. So that's a bit depressing because I think we're all doing that if we're here. Certain conditions also put you at increased risk. Anorexia nervosa, so that can be devastating in those very young women who have osteoporosis and can fracture. Also rheumatoid arthritis, overactive thyroid disease that's not treated, malabsorption diseases, and chronic kidney and liver disease, amongst others. So what do we do to try and look at your bones and how do we assess things? Well, your GP or health practitioner or whoever you see, specialist, whoever, can do a bone health assessment. Often you might need to prompt them, but if they're good and on the ball, they'll say, hang on, your mum had a hip fracture, let's look at this. We've talked about the DEXA study, which does need a referral from a doctor. So you will need to talk to someone about that. You can't just go and ask for it yourself. A blood test, there's various things you can do, like check your vitamin D, look at your thyroid hormone, all the rest of it. And a plain X-ray of the spine will often be done, just the spine from the side, to see if there's a fracture there. So this is a DEXA scan. We were talking about it before. It's the most accurate way to assess your bone density. We talked about the lower back and the hip region of scan. Some do the forearm as well. It's absolutely painless. It's like having a normal X-ray. It's used to confirm a diagnosis of osteoporosis. It also says what the severity of bone loss is, and it can determine if treatment is working. So a normal X-ray will not look at these, all right? A normal X-ray might see if there's a fracture, but it won't look at the density or the thickness of your bones. We've talked about the referral, and many pharmacists have those heel ultrasounds. You might have seen them, and it says, oh, why don't you screen yourself for osteoporosis? They are not as accurate as DEXA scans, so they might give you some guidance, but there might be false positives or negatives involved. So if you're worried about your bones, you do a DEXA. You don't rely on an ultrasound at the chemist or other place. So in terms of lifestyle, we've sort of touched on this already. The smoking's got to go, all right? Well, if it can't go altogether, reduce it to as much as you can, and when you've reduced it and stopped it, then you give yourself a big prize, okay? That's my psychology. Alcohol, Coca-Cola and other caffeinated beverages, and coffee and tea in moderation. So there are things that we can all do to work on that. In terms of calcium, as I alluded to before, there's a lot of controversy about calcium, and there are tables published for what we should be having a day. I think while the debate rages, you just go with what's been recommended. There is a brilliant website, Osteoporosis Australia. There is also a brilliant website through the Jean Hales website as well, looking at all aspects of bone health, and I think you can get this on there as well. So when we're looking at adults, for women 19 to 50 years, we're saying 1,000 milligrams of calcium a day, and women more than 50 years, a little bit more at 1,300 milligrams a day. And you might think, well, I don't know what's in my diet. Essentially, even a dairy-free diet will have around about 300 milligrams of calcium. So you can also look on the internet and get a calcium content of food. You can count your calcium within your foods, do a rough day and just say, well, this is what I'd normally eat. Estimate it out. If you're not having that level, it's easy to supplement. And we can talk more about that. So this is how we get our calcium, mostly. It's mostly within dairy products. You need about 2 to 3 serves of dairy food per day with regard to calcium intake. And a lot of women, and I reckon you're in this as well, you don't want to have the dairy because the fats are higher in the dairy and the dairy had to go. So do you know what you do? You just either supplement it or look at your diet and see how you can supplement it another way. 1 serve is a glass of milk, a container of yogurt. A lot of my women have yogurt, or a slice of cheese. So it's stuff that you can easily get at least, isn't it? Soy, rich in calcium. So if you can't have normal milk or you prefer soy, that is another source of calcium. We talked about vitamin D before. Vitamin D we're learning more and more and more about. It helps you to absorb that calcium. So you can see if your vitamin D is low, even if you're having all that calcium, it might not be going through to the bones where it's needed. So low levels are commonly seen in the elderly and when you're housebound, but they're increasingly common in Australian women. My level was 45, it should be 75. That's because I'm inside, and when I'm outside, I'm putting the hat on and all the rest of it. It's trouble, isn't it? Approximately 6 to 8 minutes of sun exposure to hands, arm and face 4 to 6 times a week is what we think is adequate for sun exposure and vitamin D, and vitamin D supplements are available. I think the easiest thing to do, get a level performed by your doctor, get some advice. We can easily supplement it in capsule or drop form or whatever, and therefore you're not at risk of your skin cancers and whatever by putting your hands out like this. It's hard stuff, but it also says that we should be getting out and about and exercising outside and being exposed a little bit to the sun. So physical activity for healthy bones is different in the different life stages. We did talk about already, and I know you've programmed it into your phones, 30 minutes of physical activity on most or all days of the week. Incidental activity is important as well. And we also say a variety of exercise, so resistance training, weight-bearing exercise, balance. Swimming and cycling don't do a lot for bones, so if you're particularly worried about your bones, you need to be incorporating other activities as well, okay? They're excellent for cardiovascular and other health. In terms of personal activity guidelines, consult a health practitioner before commencing an exercise program. Set yourself realistic goals, okay? Don't try and do the aforementioned today marathon when you haven't ever done one before. Wear appropriate footwear, don't exercise through pain, and warm up and cool down. So weight-bearing exercise relies on load and exercises from a standing position. The more you do, the greater benefit you're going to get. Tennis, dancing, skipping, excellent weight-bearing exercise. So when your skeleton is standing up and doing some sort of movement, that's where you're getting the benefit, because that's what the skeleton and all the muscles, ligaments, joints and the rest of it were designed to do. We did just talk about swimming and cycling. So exercises to avoid if you've got osteoporosis. Dynamic abdominal exercises. That sounds amazing, doesn't it? But I think that's really just doing intense stuff like this, sit-ups. Twisting movements such as golf swings. That would be really extreme golf swings. I think that'd be the sort of golf swing that I would do if I played golf, so that's why I'm not doing it. Trunk flexion, bending forward, around the abdominal cavity. Sudden jerking movements and high impact exercises. They are not great if you have bone thinning, all right? If you're at a certain level of fitness and can do all of this, keep doing them, but not if there's bone issues. So how do we manage or treat osteoporosis? We look at lifestyle to start with, and I know a lot of you can do stuff and are probably already doing stuff. Healthy eating, physical activity with weight bearing, hydrotherapy as well if there are fractures or if there's issues with mobility, and looking at risk of falls, all right? And that's typically when there's rugs and there's things at home like the dog that you trip over and the rest of it, and shoes and everything else like that. So we also think calcium replacement is very important. So have a think about your own calcium intake and try and see, if you need a supplement, your doctor can advise you, or your health practitioner, whoever you see. Vitamin D replacement may be important. There are various medications, and these are really what's available to treat bones that have had fractures and that when you have got osteoporosis. As part of that, hormone therapy may be appropriate, and this all needs specialist medical guidance, and that might be at the general practitioner level, and many are good at managing this. So questions to ask your doctor: will I notice any changes while taking medication? How long to take it for? The side effects? What should I do if I have side effects? What changes can I make to my lifestyle? And when should I come back? I mean, you're pretty good as a group from just seeing my patients at saying all of that stuff. So, you ask for it. Don't be shy. There's no need for shyness. Osteoporosis, as I said before, does have some guidance on their website. In terms of falls prevention, you may or may not perceive yourself at risk, but 1/3 of people over 65 fall each year. So it's quite a lot, isn't it? 1 in 3. 10 to 15% of these lead to a fracture, and we don't want the fracture. More common in people with poor leg muscle strength, poor balance, poor eyesight, and the wrong shoes. So staying upright. These are all very practical and sensible things. Eliminate clutter, have the lights on, that would help, and adequate lighting. Have a checkup. Check your vision. Who thinks that they need new glasses? Anyone out there? Maybe. In the front row, that's good. Correct footwear, remove rugs, rails in the shower and toilet. We don't all need to do this, but at some point in our life we might need to look at it. So it's good to sort of have it wafting through at this level, and we can deal with it later. Non-slip mats in the bathroom. Don't let the 15-year-old dog walk underfoot. Use a walking aid if you need, and exercises to improve balance. Tai Chi is excellent for balance, as is Pilates, I've got a number of women who do yoga, and I think that's increasing, and people gain a lot from doing yoga. There are a whole lot. These days, there's an enormous amount of material on the web. But having said that, there's a lot of bad stuff on the web, and my patients all come in with this and say, I should be doing this, and I just say, let's put it down and let's go through it all. There are good websites out there, and in terms of bone health and heart health and healthy living, there's a lot of them here, and I do believe you've got that material as well. You can always just put Jean Hales into a Google search. You'll come to our website pretty easily, and you can search there. There's almost anything you would need to know on that website. Thank you so much. You've been wonderful. I've tried to keep you awake and amused, and we'll be happy to answer your questions later. Thanks so much.